Welcome to this edition of Health Talk. My name is Julianne Raftery, and today I'm joined by Dr. Dave Mazzola, who's going to be talking all things runner's knee.
Perfect. So most people don't know what runner's knee is. There's a little bit more scientific name to this. It's called patellofemoral pain syndrome. So runner's knee you'll typically see, hence the name, typically more of your runners, right? Not always the case. Typical symptomatation to runner's knee is, if you're sitting for long periods of time, you go to get up, you're getting cracking, grinding, popping in the knee, specifically in the lateral portion of the knee. You start experiencing that, there could be some potential risk to runner's knee. You don't have to be a runner.
That's what my next question was
yes,
going to
be.
Yeah, so if it's more common in runners, who else do we see it in?
You can see it anybody that has lower extremity imbalance into the quadricep. You'll see it a lot with lifters as well, but even desk jockeys is what we call them. People that are sitting all day long. Muscle imbalance, quad is actually being overstretched or overactive due to sitting or standing. But typically what you'll see is in more athletes where there's repetitive abuse to that area.
So do you have any tips for desk workers or runners to avoid?
Absolutely. So I think before we even get into that, just to understand, have patients understand exactly how does this happen, right? So obviously we know it's a repetitive injury. Typically what you'll actually see is there's imbalance in musculature in the lower leg. So you'll see it a lot of times, people do a lot of running, but they're not doing a lot of hamstring, right? So a lot of tight inhibited hamstrings, calves, things like that can lead to this injury. Also quadricep, quad being 4, there's 4 muscles in that quadricep, right? If you have any imbalance from medial to lateral, what can happen is that can actually create malposition of the patella, which is the kneecap. When that happens, when you consistently bend and straighten your knee, you probably just heard it there, the popping and crepitus there. So what happens is if you have imbalance from left to right or medial to lateral, what can actually start to happen is the patella can start to actually track out of alignment. So what you'll typically see with most patients is how we walk, how our gait is. Typically the outer portion of the quadricep muscle, which is the vastus lateralis muscle, typically very, very, very strong, versus the inside muscle, which is vastus medialis, typically very weak. And you see it if you work out in the gym, you have that teardrop muscle, right? So a lot of times when we're squatting, we keep our toes straight or our toe fans out or in a little bit. What that does, it changes what muscles you're firing into the quadricep. So long story short, what you'll see is this outer portion of the quadricep gets a lot tighter, and then due to inhibited hamstrings, to where now when you start to bend and straight that knee, the patella is not staying in the particular track. What can actually start to happen is the patella can start to shift laterally. That can create grinding, popping, kind of like a train being off the tracks. You're getting grinding over that patella joint. So what can happen is then you can start getting inflammation, swelling in and around that knee. You'll get more crepitus, cracking, popping, discomfort. So but you can see if you're sitting for long periods of time and your knee is bent, you can start causing these muscles to contract. So then when you go to stand up, you hear crack, pop. Like I said, not all the time is that just things moving. That could actually be a warning sign into some of this becoming a runner's knee or patellofemoral syndrome.
So what does treatment typically look like?
So treatment is typically more hands-on. So there's obviously you can do your passive, treatments, your price, icing, pressure, elevation, resting. Especially if you're a runner, sometimes you need to take time off of this. But there's a lot more active treatment that has to go on with this, because this isn't just, hey, I broke a bone or hey, I bruised something. This is an actual imbalance in musculature. So the only way to fix that is becoming a little bit more active in the care that you do. So you need to start structuring hamstring, calf, even tibialis anterior, which is the anterior muscle in your leg, strengthening into your program. You need to make sure that you're firing each quadricep muscle equally. That imbalance leads to this issue. Running, typically, you see why it's called runner's knee, is it accelerates this because you're stressing that joint at a higher rate than you would be if you're sitting. Make sense?
It does. How long is the recovery period typically?
So recovery time, anything you're talking soft tissue, typically we tell people, that's why you hear the rumor of, hey, it's better to break something than it is to have a soft tissue injury, because bone typically heals in 4 weeks. You start getting into the muscular world, you're looking at 6 to 8 weeks. And that's typically with rest. So if you're a runner, it becomes very hard because we have to potentially remove a little bit of that inflammatory factor, right? So we can actually start creating the balance. So you're looking anywhere 6 to 8 weeks, depending on, are you a runner, or are you just somebody who's a little bit more inactive that's having the pain?
So what would you tell athletes, especially runners, who are looking to prevent runner's knee to do?
Yeah, so I mean, obviously, the first thing would be is pain's usually a good indicator is there's something going on, right? But I can tell most people with how we live our lives, there has to be some sort of imbalance from quad to hamstring and even in the quad muscles itself. I always tell people, we walk forward, we don't walk backward, right? That's why a lot of times we have more injuries posterior chain, right? So hamstring, glute, calf, things like that. So I could already tell people, most people have this injury or have the symptoms of this going on. It's just sometimes as the intensity of the workouts or, running, things like that will bring this on. A lot of times it takes something like that to kind of generate, hey, that I have this issue. But what I would tell people is if you're getting grinding, popping, anything like that, discomfort in the knee, specifically laterally, there could be an indication that there's something going on there. Yeah. And I always tell people, I get asked a lot, is pain normal? It's not. People get a little desensitized to it to where if it's not impacting their everyday life that they kind of push it to the side.
Ignore it.
Yeah, pain is your body's alarm system telling you something's wrong. You want to do something about that. So you're not supposed to be having lateral knee pain. You're not supposed to be having a lot of popping and cracking in the knee. If you are, and grinding, you know that there's a situation going on. You have to do something about it. Right. If not, you keep pushing yourself, you're pushing your body to the limits, running, working out, you will exacerbate the symptom, and then it becomes a lot harder to manage it, and the treatment options sometimes get a little bit more aggressive.
Yeah. Is there anything else you'd like to share with the audience today about?
I think I think we covered a lot. I would just tell patients, obviously we're a chiropractic office. We deal with a lot of athletic injuries. This is something we see quite a bit of. All the physicians here treat this very successfully. We do, like I said in previous episodes, we do have newer treatments that we're starting to incorporate in that have been really helpful with us treating some of these soft tissue conditions, specifically laser and shockwave. So what I'll tell you is if there's any issues you're having, whether it be in your knee, neck, back, elbow, shoulder, that is not a normal thing. Please get that checked out. We may be able to help you. Even if it's not at this office, go somewhere to get it checked out because a lot of times pain ain't going away on its own.
Well, thank you so much for being here today. I appreciate it.
Yeah, appreciate it. Thank you.
Thank you. Good day and good health.